Hi all my dear nurses. എല്ലാവരും സുഖമായിട്ടിരിക്കുന്നു എന്ന് വിശ്വസിക്കുന്നു. കുറച്ചധികം നാളുകൾക്ക് ശേഷമാണ് ഞാനൊരു പുതിയ വീഡിയോ ചെയ്യുന്നത്. അപ്പോൾ ഈ വീഡിയോയിൽ ഏറ്റവും കൂടുതലായിട്ട് നമ്മൾ ഫോക്കസ് ചെയ്യുന്നത് ഇപ്പോൾ കറൻ്റ്ലി എക്സാംസിന് വേണ്ടിയിട്ട് പ്രിപ്പയർ ചെയ്തുകൊണ്ടിരിക്കുന്ന എല്ലാ നഴ്സസിനും ഒരുപാട് യൂസ്ഫുൾ ആവുന്ന ഒരു വീഡിയോ ആണ്. ഈ ഒരു വീഡിയോയിൽ ഞാൻ ഫോക്കസ് ചെയ്യുന്നത് എക്സാംസിന് ഫ്രീക്വൻ്റ് ആയിട്ട് ചോദിച്ചിരിക്കുന്ന ക്വസ്റ്റ്യൻസ് ആണ്. ഈ ക്വസ്റ്റ്യൻസിനെ എങ്ങനെ അപ്രോച്ച് ചെയ്യാമെന്നും സാധാരണ നമ്മൾ ക്വസ്റ്റ്യൻസ് അപ്രോച്ച് ചെയ്യുമ്പോൾ ക്വസ്റ്റ്യൻസ് വായിച്ചാൽ മനസ്സിലാവും. അതിൽ നിന്ന് 4 ഓപ്ഷൻസിൽ 2 ഓപ്ഷൻസ് വരെ നമുക്ക് ഈസി ആയിട്ട് എലിമിനേറ്റ് ചെയ്ത് കളയാനും സാധിക്കും. പക്ഷേ ഏറ്റവും അവസാനത്തെ 2 ഓപ്ഷൻസിൽ നിന്ന് കറക്റ്റ് ആൻസർ എങ്ങനെ സെലക്ട് ചെയ്യും എന്നുള്ളത് ഒരുപാട് കാൻഡിഡേറ്റ്സിൻ്റെ ഒരു കൺഫ്യൂഷനാണ്. പ്രത്യേകിച്ച് നമ്മൾ ക്വസ്റ്റ്യൻ പ്രാക്ടീസ് ചെയ്യുമ്പോഴല്ല അത് ഏറ്റവും കൂടുതലായിട്ട് വരുന്നത്. ഇത് എക്സാംസിന് നമ്മൾ കമ്പ്യൂട്ടറിൻ്റെ മുന്നിലിരിക്കുമ്പോൾ ഒരു ഭയങ്കര കൺഫ്യൂഷനാണ്. നമുക്ക് റെഫർ ചെയ്യാനോ ആരോടെങ്കിലും ചോദിക്കാനോ ഒന്നും ചെയ്യാൻ പറ്റാത്തൊരവസ്ഥ. സോ ഒരു ക്വസ്റ്റ്യൻ നിങ്ങൾ എക്സാംസിന് മുമ്പ് പ്രാക്ടീസ് ചെയ്യുമ്പോൾ, ഓരോ മോക്ക് ടെസ്റ്റും പ്രാക്ടീസ് ചെയ്യുന്നതിന് മുമ്പ് തന്നെ ഈ ഓരോ മോക്ക് ടെസ്റ്റും എൻ്റെ എക്സാംസിൻ്റെ ക്വസ്റ്റ്യൻ ആണെന്ന് കണ്ടുകൊണ്ട് സമയം ക്രമീകരിച്ച് പ്രോപ്പറായിട്ട് രീതിയിൽ തന്നെ ക്വസ്റ്റ്യൻസ് ചെയ്യാനായിട്ട് ശ്രമിക്കുക. ഫൈൻ. അപ്പം എങ്ങനെ ഒരു ക്വസ്റ്റ്യനെ അപ്രോച്ച് ചെയ്യണമെന്നും അങ്ങനെ ക്വസ്റ്റ്യൻ അപ്രോച്ച് ചെയ്താൽ ഏതൊക്കെ രീതിയിൽ നമുക്ക് ബെറ്റർ ആയിട്ട് എലിമിനേറ്റ് ചെയ്യാമെന്നുള്ളതുമാണ് ഈ വീഡിയോയിൽ ഡിസ്കസ് ചെയ്യുന്നത്. അതുകൊണ്ട് വീഡിയോ മുഴുവനായും കാണാൻ മറക്കരുത്. സോ ഹിയർ ഇസ് ദ ഫസ്റ്റ് ക്വസ്റ്റ്യൻ.
5-year-old is being tested for pinworm, and to collect the specimen for assessment of pinworm, the nurse should teach them to examine the perianal area with a flashlight 2 to 3 hours after the child is asleep, and scrape the skin with a piece of cardboard and bring to the clinic. Obtain a stool specimen in the afternoon. Bring a hair sample to the clinic for evaluation. So remove the wrong answers, then select the correct answer. Bring hair sample to the clinic. It is wrong. And scrape the skin with a piece of cardboard. It is a sharp thing. Never do that. B is also wrong. Stool specimen in the afternoon. Normally the pinworm which comes out during the night. So I think the answer is A is the correct answer. Examine the perianal area with a flashlight. Asleep. Yeah. Next question. The nurse is teaching a mother regarding treatment of enterobiasis and which instruction should be given regarding the medications. So worm infestation medication. The treatment is not recommended for child less than 10 years of age. The entire family should be treated and therapy will continue for 1 year. Intravenous antibiotic therapy will be ordered. Please remove the wrong answers, otherwise you won't get the correct answer. So remove the wrong answers and you will get the answer.
Enterobiasis
Infection. Worm infestation ille. So wrong statement parayu. A is a wrong statement. Treatment is not recommended for a child less than 10 years of age is wrong statement because we have to give like before 10 years. A is wrong, and then medication therapy will continue for 1 year is completely a wrong statement. Intravenous antibiotic therapy, no, wrong. So the answer is the entire family should
be treated.
Registered nurse is making assignments for the day. Which client should be assessed to the pregnant nurse? Question clear? Client receiving linear acceleration radiation therapy for a lung cancer. The client with a radiation implant for a cervical cancer. The client who has just been administered a soluble brachytherapy for thyroid cancer. The client who returned from a placement of iridium seeds for a prostate cancer. Out of this, patients are receiving radiation therapy. A is external radiation, B, C, and D is internal radiation. Where internal radiation therapy patient is considered as radioactive. Option B, radium implant is on the cervix. When this radium implant is kept in the cervix, that will remain in the cervix itself, and from the patient's body, the radiation comes out. So the pregnant nurse cannot give care to the patient. So B can be removed. And soluble brachytherapy for a thyroid medication, it is administered. Again, there will be chances to get a getting radiation exposure. And prostate cancer are implanted, that will also causes radiation. Okay, so angane varuvaanengil edayirikkum answer? The client is receiving linear accelerated for answer. Okay, when you take care of a patient with a radiation, see, radiation, there are two kinds of radiation, internal radiation as well as external radiation. What is external radiation? The radioactive isotopes are just, so for example, if this is a radioactive isotope, it will be kept over out of the body, and from the radioactive isotope, the radiation comes, and we will get a radiation. Okay, so where the radioactive isotope is implanted outside the body is considered as a external radiation. What is internal radiation? The radioactive isotopes are implanted inside the body, so from the patient's body the radiation comes out. Okay, so whenever you care a patient with the internal radiation, you should wear a lead apron and reduce the contact with the patient. Never get continuous contact with the patient. Even if you wanted to take a BP of the patient, you can just maintain one full hand distance. You can just maintain a distance with the patient, and then you can do the whatever the actions. And whenever you just enter into the patient's room, you have to wear dosimeter badge. Have you heard about dosimeter badge? The X-ray technician who wears this, that will calculate the radiation exposure. So you have to wear dosimeter badge and a lead apron and complete entire activities, entire nursing care, and then inform the patient that I will be only return back when you call. മനസ്സിലായോ? പേഷ്യന്റിന്റെ റൂമിലേക്ക് കയറുന്നു, entire activities ചെയ്യുന്നു, then patient inform ചെയ്യുന്നു, I'm not going to come anymore and unless and until you call me. Fine? Okay. And internal radiation, whenever you care or whenever you admit a patient with a radiation, the radiation room or the patient's room should be always away from the nurse station, because whenever the room opens, the radiation comes out. So the room which is very closer to the nurse's room is considered as a crowded area, where away from the nurse station is a free area. Upon no one will get infection, no one will get radiation exposure when you admit a patient in the room which is away from the nurse station. Clear ayo? Yes. Internal radiation therapy. In case of external radiation therapy, only you have to take care the skin, exposed skin. Skin care is only necessary after external radiation therapy. The skin area never wash with the soap, never apply any chemicals or anything over there, and never remove the markings which is already created for the radiation. And better you have to ask the client to never get a contact with the sunlight. Okay, because after external radiation the skin is already irritant അല്ലെങ്കിൽ ഭയങ്കര delicate ആയിട്ടിരിക്കുകയാണ്. Then after external radiation, again the patient is going to the sunlight, it might cause further irritation to the skin and it causes burns. So better avoid that. Okay, nursing care of a client with the internal radiation as well as external radiation. Repeat question: how do we take care of a patient with external radiation? How do we take care of a patient with internal radiation? Fine. Next question: the nurse is planning a room assignment for a day. Which client should be assigned to a private room if only one is available? The client with the Cushing disease, the client with the diabetes, the client with acromegaly, the client with the mixed edema. So ഏത് പേഷ്യന്റിനെയാണ് നമ്മൾ സിംഗിൾ റൂമിൽ അഡ്മിറ്റ് ചെയ്യുന്നത്? That is a question here. Yes. Read the option and ഞാൻ ഓരോന്നിന്റെയും ഡിസീസ് എന്താന്ന് പറയാം. What is Cushing syndrome? It is hypersecretion of
cortisol,
glucocorticoid and mineralocorticoid. Okay, so that is Cushing syndrome. And what is diabetes? Diabetes അറിയാലോ? The insulin. And what is acromegaly?
and in the extremities,
Is the growth hormone. And what is myxedema? Decreased thyroid hormone. I'll write T3 or T4. Okay. So yes, ഏത് പേഷ്യന്റിനാണ് പ്രൈവറ്റ് റൂമിൽ അഡ്മിറ്റ് ചെയ്യേണ്ടത്? That means ഏത് പേഷ്യന്റിനാണ് ഇൻഫെക്ഷൻ കിട്ടാൻ ചാൻസ് ഉള്ളത്? So for that patient you can admit the patient in a private room. Yes.
diabetes,
ഏതാ?
diabetes,
Diabetic why? ഞാൻ കുറച്ച് കീ പറയാം. കീസ്. Excessive use of corticosteroids causes adrenal suppression. Diabetic patients are risk for infection, but it is not diabetic patient. Extreme diabetic ketoacidosis. Initially for a patient with a diabetes, no. See, when a diabetic patient get exposed with any of infection, patients get worsen and the patients could end up with diabetic ketoacidosis. I repeat, diabetes ഉള്ളൊരു പേഷ്യന്റിന് ഇൻഫെക്ഷൻസ് ആയിട്ടൊരു എക്സ്പോഷർ വന്നാൽ there will be chances to get a diabetic ketoacidosis or extreme uncontrolled hyperglycemia. So diabetic patients in infection varadirikkan ശ്രമിക്കണം. It is necessary. Growth hormone and infection doesn't require, like avada oru connection illa. Myxedema, no. So either A or B. Which medicine or which hormone is causing adrenal suppression? Steroids. Fine. Yeah. So the answer is a client with Cushing syndrome or Cushing's disease. Manslayo rather than diabetes. Clear? Yeah. What is the side effect of steroids? See, glucocorticoid എന്ന് പറയുന്നത് steroid ആണ്. Corticosteroids ആണ്. Yeah. So what is the side effect of steroid? It increases glucose or it causes metabolism. 4 functions ആണ് steroids നമ്മൾ പഠിച്ചത്. The number 1 is metabolism. That means it releases glucose from protein as well as lipid. I repeat, ഞാനിപ്പോൾ പറയുന്നത് ഗ്ലൂക്കോകോർട്ടിക്കോയിഡിന്റെ ഫങ്ഷൻസ് ആണ്. ഫങ്ഷൻസ് ഓഫ് ഗ്ലൂക്കോകോർട്ടിക്കോയിഡ്. It increases production of RBC. Sorry, it increases the RBS, random blood sugar, or the blood sugar excessive at releasing from fat and protein. Okay, so glucose will be released from fat, that means lipid, and amino acid. That's the first function. Second function steroid is it increases cardiac contractibility. So as a result of that, it increases PP. And third is it retains water. So it causes edema. And fourth is anti-inflammatory function. Okay, anti-inflammatory function fight against infections. But excessive use of steroids always suppress adrenal gland, and it causes chances of infection. Okay.
Yeah.
Glucocorticoid excessive ആയിട്ട് എടുത്ത large dose of steroids എടുക്കുവാണെങ്കിൽ ഈ large dose of steroids always നമ്മളുടെ immunity reduce ചെയ്യും. Okay, and it causes myelosuppression also, bone marrowയും suppress ചെയ്യും. Okay, അങ്ങനെ ഇൻഫെക്ഷൻസ് കിട്ടാനുള്ള ചാൻസ് കൂടുതലായിരിക്കും. അതുകൊണ്ട് സ്റ്റീറോയിഡ്സ് കണ്ടിന്യൂസ് ആയിട്ട് റിസീവ് ചെയ്യുന്ന പേഷ്യൻസിന്, ഏതെങ്കിലും പേഷ്യൻസ് സ്റ്റീറോയിഡ്സ് കണ്ടിന്യൂസ് ആയിട്ട് എടുക്കുന്നുണ്ടെങ്കിൽ അവർക്ക് ഇൻഫെക്ഷൻ കിട്ടാനുള്ള ഒരുപാട് കൂടുതലാണ്, and they have to be admitted in a private room. But ഇവിടെ patient is not taking steroids, but the patient's body itself has excessive amount of steroids. That is the reason why the patient has developed Cushingoid features. Clear?
Okay.
Yes. The nurse is caring for a client in a neonatal intensive care unit, administered adult digitalis to the 3-pound infant. As a result of her action, the baby suffers permanent heart and brain damage. The nurse can be charged with adult strength digoxin ഒരു കുഞ്ഞിന് അഡ്മിനിസ്റ്റർ ചെയ്തു. As a result of that her action, the baby suffers permanent heart and brain damage. So nurse can be charged with negligence, tort, assault, malpractice.
Also,
Yes. Assault, Anna. It is not assault and tort. What is assault? Without a permission, if you are damaging the physical body of the patient, it is physical assault. Emotional, damaging the emotional status, it is emotional assault. അപ്പോൾ ഒരാളുടെ ശാരീരികമായിട്ടും മാനസികമായിട്ടും വേദനിപ്പിക്കുന്നതും ആണ് അസോൾട്ട് എന്ന് പറയുന്നത്. What is tort? Tort is like damaging not only the patient, even the patient's belongings. പേഷ്യന്റിന്റെ എന്തെങ്കിലും not only patient, it is a person's. It's not only damaging the persons, it is damaging the person's belongings. ഒരാളുടെ വണ്ടി കത്തിക്കുക, ഒരാളുടെ വീടിന്റെ ജനല് കല്ലെറിഞ്ഞു പൊട്ടിക്കുക, ഇതൊക്കെ ടോട്ടായിട്ട് വരും. മനസ്സിലായോ? അയാളെ മാത്രമല്ല അയാളുടെ വസ്തുവകകളെയും ഡാമേജ് ചെയ്യുന്നതിനാണ് ടോട്ട് എന്ന് പറയുന്നത്. ആൻഡ് നെഗ്ലിജൻസ്, just neglect the thing, അതായത് professional duties are not properly performing. Malpractice is professional negligence is considered as a malpractice. So the answer is better answer is malpractice, where your license can be cancelled. Okay. Next, which assessment should not be performed by the licensed practical nurse? Inserting Foley's catheter, discontinuing the nasogastric tube, obtaining sputum specimen, starting blood transfusion. Important. Which one should not be done by practical nurse? Which one is that answer? Licensed practical nurse. Eda? Licensed practical nurse are not supposed to give medications, or they are not supposed to administer any of medications.
Obtaining a sputum specimen.
That should not, Anna. Which assignment should not be performed? Not should be. എന്ത് ചെയ്യണം എന്നല്ല, ചെയ്യരുത്. Listen.
Starting blood transfusion.
Yes. Okay. So inserting Foley's catheter, discontinuing nasogastric tube, obtaining sputum specimen can be done by licensed practical nurse, but completion of nursing process and any blood medication administrations are not supposed to perform by licensed practical nurse. Next is the client returns to the unit from surgery with blood pressure 90/50, pulse rate high, respiration is high. Which actions by the nurse should receive priority? What is this Indicating, it is indicating hypovolemia. Yes. Continuing to monitor the vital signs, contacting the physician, asking the client how he feels, and asking LPN to continue post-operative care. So you can remove 2 answers from this. And then see, I think C and D, no, it is not necessary. Asking the client how he feels is wrong. That is your point appropriate. And asking the LPN to continue is also D can be removed. Either continue monitor vital signs and contacting the physician. So already BP is low here. So you can, you can contact the physician. Next, which nurse should be assigned to care for the postpartum client with a preeclampsia? Which nurse should be assigned to care for a postpartum client with a preeclampsia? RN with 2 weeks of experience in postpartum, RN with 3 years of experience in labor and delivery, RN with 10 years of experience in surgery, RN with 1 year experience in neonatal intensive care unit.
B is the answer. And you're wrong.
A, 2 weeks experience in postpartum, they won't be able to handle this patient. A can be removed. Neonatal ICU, neonatal intensive care unit, 1 year of experience can be removed. And B and C. So the correct is
B.
Second one. Yeah. Second one is the answer. The RN with 3 years of experience in labor and delivery. 10 years of experience in surgery. Yes, the nurse is experienced nurse, but she's not having much experience regarding the postpartum care and labor, antenatal and intranatal and postpartum care. So 3 years of experience in labor and delivery, usually that is okay. So this B is the correct one. Next is which information should be reported to the State Board of Nursing? Which information should be reported to the State Board of Nursing? The facility failed to provide literature in both Spanish and English. The narcotic count has been incorrect on the unit for the past 3 days, and the client failed to receive itemized account of his bill and service received during his hospital stay. And the nursing assistant assigned to the client with the hepatitis failed to feed the client and give the bath. State Board of Nursing inform ചെയ്യേണ്ടത് ഇതിനകത്ത് ഏതാണ്?
The narcotic count has been incorrect.
So negligence can be reported. Okay, ബാക്കി ഒന്നിന്റെയും ആവശ്യമില്ല. So the correct answer is the narcotic count has been
incorrect on the unit.
3 days. ബാക്കി ഏതെങ്കിലും optional, if you have any doubt, you can just ask me. Any other option if you are confused with any other option. Second last question. The nurse is suspected of charting medication administration that he did give. After talking to the nurse, the charge nurse should. The nurse is suspected of charting medication administration that he did not give. After talking the nurse, the charge nurse should call the Board of Nursing, file a formal reprimand and terminate the nurse, charge the nurse with a tort. You can just remove the wrong answer, then you will get the correct answer. Board of Nursing inform cheyuvena avashyundo? No. So second thing, file of a formal reprimand. That can be, yeah. And third is terminating the nurse. No, not necessary. Terminate ഈ ഒരു കാരണത്തിന്. Termination, no. And charge the nurse with tort. Tort ഒന്നുമല്ല, no. So the answer is file a formal reprimand or a disapproval. നിങ്ങൾ ചെയ്തത് ശരിയായില്ല എന്ന് പറയുക. മനസ്സിലായോ? Next question. The home health nurse is planning for the day's visit. Which client should be seen first? ഏത് ക്ലയന്റ് ആണ് ഫസ്റ്റ് കാണേണ്ടത്? 78-year-old who had gastrectomy 3 weeks ago and has PEG tube. The 5-month-old discharged 1 week ago with pneumonia who is being treated with amoxicillin liquid suspension, and 50-year-old with MRSA being treated with vancomycin through PICC line, and 30-year-old with exacerbation of multiple sclerosis being treated with cortisone via centrally placed venous catheter. So which patient you will assess first? Number 1, 78-year-old patient, gastrectomy 3 weeks ago. The particular patient doesn't require any important care. C. Second one, B. 5-month-old discharged 1 week ago with pneumonia who is being treated with amoxicillin, doesn't require any extra care. And C. 50-year-old client with MRSA, currently on treatment. 30-year-old exacerbation of multiple sclerosis being treated with a cortisone via centrally placed venous catheters that need to be assessed first and treated first and planned for a care. So the correct answer for this is option